Hey guys, my name is Dan. I'm a veterinarian and welcome to the channel. It is early. I got my Papillion Animal Hospital sweat on because I got work today, and it's gonna be a long one like usual. Like most veterinarians, I work usually at least a 10-hour day, if not 11 or maybe 12 sometimes, but usually like 11ish. Anyway, today we're talking about heart meds in the dog. And heart meds in the dog are incredibly common. Veterinarians, oh man, veterinarians prescribe, recommend, adjust heart meds on a daily basis. Unfortunately, guys, dogs tend to have a lot of heart problems. Some of the most common ones would be, mitral valve disease, left-sided heart disease. It's when the mitral valves have regurg or when the heart pumps, some of the blood goes backwards. You can have other problems too, but a heart murmur is pretty common, especially in some of your smaller dogs. You can definitely have dilated cardiomyopathies and more complex problems, but a lot of times we're dealing with slow congestive heart disease that usually is diagnosed with a heart murmur or a cough. The meds I'm going to go over today there's usually about 3 of them. Now, don't give me a hard time. There are definitely medicines that have combined some of these. There is definitely a number of other options out there. But when we're thinking of just like congestive heart disease and meds that most people are going to pick, I would say these are going to be the 3 most common ones. And the number one we tend to think about first would be your furosemide or your Lasix. A lot of people will call this the water pill, and this is incredibly helpful at pulling out fluid from the lungs. So, guys, a lot of you may, be familiar with this. The dog starts to cough, it breathes harder, it has a increased respiratory rate, and you go in and your veterinarian says, "Oh, okay, I hear a heart murmur." And murmurs are graded from 1 to 6, 6 being really, really serious, 1 not being quite as bad. So the veterinarian does this, and they take an X-ray, and then they see like some increased fluid in the parenchyma, the tissue of the lungs, and they're like, "Oh my gosh, we have heart disease." What a vet does then is they usually grab the Lasix as one of the first medicines they grab. And Lasix literally just helps to dry out the lungs by affecting the kidneys. And by affecting the kidneys and allowing more fluid to escape the kidneys, the fluid on the lungs tends to dissipate or dry up quite quickly, actually. And once that happens, everything dries up. And even though you still have a heart murmur, guys, the lungs, they just are dry, so they feel better. And the dog's respiratory rate drops. The dog may not cough as much. They just feel a lot better just by adding a simple water pill. That's number one. Number 2, the veterinarian in a lot of cases will probably recommend pimobendan or vetmedin. No joke, guys. This is going to be one of your more expensive ones. And this is the one I get a lot of pushback on, and for good reason. Like, it's an expensive medicine. But it is one of the few medicines that helps the heart with its contractility. It helps the heart to beat stronger and better. And guys, as you have a heart murmur and the heart has congestion and it gets a little bit bigger, let's say, the muscle gets a little bit thinner, it's not as strong, you're not going to have a heart beating as well. And then you can get congestion in the heart. Once you get congestion, you really need that heart to beat stronger and better for you. So pimobendan or vetmedin is going to help the heart beat stronger and better. Talk to your veterinarian about it. Either get it at your vet office or get it at an outside human pharmacy or some of the pet pharmacies. Definitely shop around if you can't find the price that works best for you. But it can be hard to find for a good price. A lot of people are spending about $100 to $130 a month on it. I know in the grand scheme of things, if human medicine doesn't sound horrible, but that's a lot of money still. So we covered our Lasix and then our vetmedin. And then the third one, which is not always prescribed, but is prescribed pretty regularly, would be your ACE inhibitor. ACE inhibitors are commonly done. They do affect fluid and also vasodilation. They are a good add-on drug to help out with the Lasix and the vetmedin. and consider them to just as a third component to your heart treatment. And I'm not going to go too much into it, but they are a good add-on drug to help out with fluid regulation and the vascular support of a dog with congestive heart disease. Those are your 3 meds that most veterinarians will prescribe. And again, guys, heart disease is incredibly common in dogs. And sometimes, guys, heart disease, dogs can have it for years and be asymptomatic with no symptoms. And when they start seeing symptoms, we can treat and extend their quality of life and their life even longer. Sometimes you'll get dogs that have really bad heart disease, like heart-based tumors, dilated cardiomyopathy, constrictive diseases, chordae tendinate tears, all kinds of stuff that have a dog going from relatively stable to not stable at all. And that is really frustrating because we feel like we should be able to extend dogs' lives super long with various meds. But in some cases, no matter how good you are at your vet is at diagnosing the problem, and no matter how good you are at seeing the problem and treating it, sometimes you cannot extend the doggy's life if they have a major cardiovascular problem. All right, guys. Hope that was crazy helpful. I hope all your dogs are happy and healthy, and you all have a great day. I'm going to work. Take care.